Greetings, it's New Zealand naturopath Eric Bakker. Thanks for tuning into my video. I'm the author of a book called Candida Crusher and also the formulator of a range of products called CanXida. Thank you so much for checking out my video. We're going to do a case history today from a very lovely lady from Sweden, and her name is Natalie. Natalie's quite an extraordinary person. Now I've got Natalie's case taking notes here. These are not fake, these are genuine. This is not a fabricated case. This is a real case. And in fact, this case is not unlike my case originally. I had a multitude of symptoms. I had anxiety, depression, pain. I had so many problems. The doctors thought I was absolutely nuts. They didn't know what to do with me. In fact, I was going crazy more from the fact that nobody believed me when I told them how I felt. That drove me insane. And I think it drove Natalie insane too. Natalie now is so much better. And I'm so happy about her improvement. In fact, Natalie is an extraordinary person. She started a Facebook page. I've got it open here. I can't read Swedish, but it is a Candida Cleanse Sweden group. And so far we have 7,808 members on that group. And Natalie's been very, very generous in sharing a lot of my information with these members. So thank you so much, Natalie. I really appreciate all you've done in helping to spread the word about yeast infection. So Natalie's from a very nice place called Stockholm in Sweden. Sweden's a beautiful country. It's a very clean country, nice friendly people, quite a remarkable country indeed. So let's talk a bit about Natalie. Natalie is a 43-year-old lady. I'll just go through these notes here. She's from Stockholm in Sweden. I have been more or less sick all my life. Excuse me. I'll just read out actually Natalie's notes here so you can just take it from these notes. I have been more or less sick all my life. I have had about 20 antibiotic treatments before I was even 10 years old, and about 20 more during the remainder of my life. I've taken pills for most everything since I was 15 years of age. I've probably had many cysts since I was 15. I've had several surgeries for endometriosis and various other cysts in my body, and also kidney stones at the age of 15. I've had gallbladder problems. I've suffered from inflammatory and irritable bowel disease. I've also had various kinds of heart issues which they couldn't diagnose. I've had headaches, pain throughout my body, constipation and diarrhea on and off all through my life. This sounds terrible, but this is not unusual for a yeast infection case. When somebody's been chronically unwell with yeast infection, and particularly if they go on more and more antibiotics, the symptoms ramp up. They get worse and worse over time. And particularly for females as they go through hormonal phases at the menarche, at the beginning or the onset of the period, because remember, estrogen starts really coming into its own right. Okay, estrogen is a hormone that's required for sexual maturation of the female. Breast development, vaginal development, all of this is dependent on estrogen. So as estrogen starts coming in, Candida often gets really bad. Candida can also spike in women who've got polycystic ovarian syndrome, who've got endometriosis and various other kinds of estrogen anomalies. Many women also go through huge problems when they go through the menopause, of course. So all my symptoms, exclamation mark. I can tell that Natalie's a very excitable person. Endometriosis and cysts. I've had several surgeries over the years. Internal bleeding. Geez, what a pain, she's writing. More pain than kidney stones and giving birth together. Vaginal thrush since I was 12. I've used fluconazole and diflucan so many times I can't remember. Vaginal yeast infection so many times. I've had strange functional heart issues since I was 22. I've had cell changes on moles since I was 22 and uterine cell changes since 2014. My period disappeared for 9 months in 2014. I've been diagnosed with inflammation of the ovaries. I've had extreme pain in the gallbladder, liver cramps and kidneys for the past several years. I've had many infections with C-reactive protein over 200 and very strong period pains. Inflammatory bowel disease diagnosis and irritable bowel syndrome. Abnormal gut cramps. Emergency, been to the emergency room several times, often involving nausea. Very bad back pain for 4 years. Multiple muscle and joint pains. Lots of skin problems, very itchy all over my body, nose and ears. I had the same, Natalie. When I had bad candida in my 20s, I was itching like crazy in the private area, in the ears, in the scalp, rectal itching, itching everywhere, all over the skin. It was terrible. Headache, migraines, not uncommon with Candida. I used to suffer from terrible migraines all the time. Fever on and off. See, this is the fermentation. The yeast actually starts breeding in the body, and fermentation takes place. It starts to eat sugars and digest different types of bits of food particles it can get its hands on, and this will create fermentation. Perspiration can occur, sweating, heating, and you almost feel like you're having a fever. Sleeping issues, carpal tunnel syndrome, brain fog, and many different fatigue-like symptoms. Watery eyes, watery nose, dry eyes, multiple food allergies. Lots of allergies to apples, oranges, pineapples, lemons, gluten and dairy sensitivities. Hard to swallow certain foods at times, especially breads. What else is she saying here? White tongue, lots of different colours on the tongue at times. Ear infections. Also even discharge coming out from the ear on and off for many years while sleeping. And tinnitus for 10 years, which is also a common Candida complaint. Heartburn. Depression, didn't know why. Anxiety, didn't know why. No one could tell her why she felt like this. Joint pain in the fingers, very common, Natalie. Many people who have Candida also have bad bacteria and low levels of beneficial bacteria. So this can often occur, a build-up of what we call circulating immune complexes in the body. So the immune system ramps up. It starts attacking cellular debris from the Candida. Fragments from Candida actually start forming. I've written about this in my book. If you have a look, there's various toxins. There's one called gliotoxin produced by Candida. It can actually evade the immune system. It can travel into the brain, different parts of the body, and create extreme mood disorders with many different people. Pins and needles on my hands, feet, legs, and restless legs. The last 5 years I've had very bad and dizzy sight, which is now 90% improved. Even bad sight is coming back. I've been given lots of pharmaceutical medicines over the years, lots and lots and lots, she writes here, of antibiotics, heart pills, lots of various kinds of beta blockers, oxynormin, oxycontin, morphine, various gut medicines, Xanax, antidepressant pills, birth control pills, pills. This is very common with chronic yeast infection patients. They get put on one drug, another drug, and after a while they've been on 50 or 100 different drugs, and no drugs seem to make the difference. I've had so many pills in my youth. They stopped giving me all these pills because I got such terrible migraine. Estrogen pills created terrible migraine. I often see this with young women, serious headaches from estrogen. So if you're taking the birth control pill and you get bad headaches, you may want to stop the birth control pill to see if there's a link. These pills can create huge liver toxicity. The past 4 years, I could hardly function at all. I crawled up from my bed, crawled on the floor, crawled up the stairs. I had terrible pain all over my body. My boyfriend had to help me dress and undress. Also had to help me in the shower. If I could I could not hold on to anything anymore. I had so much pain and such terrible weakness. I actually thought that this was it. It was all over for me now, and it was my time to leave this earth. It's really sad when I read these stories of people that have given up. I'm dealing with a couple of patients at the moment that are suicidal from Candida. One female who's given up completely. She's about 24 years of age, and the doctors have basically said she's manic depressive because she's got a lot of different strange symptoms. She's in fact got a serious yeast infection. She's been made so toxic from all the drugs she's been taking as well. The doctors just wanted to give me more and more pills and told me that some are more sick than others, and I had to learn to live with it. This is exactly what I was told, Natalie. I was told to go home and see a psychiatrist and to get on with my life, and that there was no such thing as a yeast infection. And this what drove me to despair. It drove me crazy. My mother wouldn't believe me. My girlfriend left me. Everyone thought I was stupid. I was nuts. I was going out of my mind. And that's what made me even more determined to find out what the hell was wrong with me. Because I knew there was nothing wrong with me in terms of my mental health. But the doctors made me feel like I was an idiot, when in fact I wasn't. The doctor said, we can only help you with pills for pain and all your issues and symptoms. You can go to the pain medicine center and learn how to handle your pain. Well, okay, the doctors suspected a lot of different diseases. They did all the blood tests, but they always came back NAD, no abnormal diagnosis. So, the one thing that is shown in the past several years is low B12, low iron, low blood sugar, even directly after meals. So low B12 is quite common, Natalie, with yeast infection, and very common to have low iron. The reason why low B12 is common is because the stomach gets affected quite a lot, and especially the small intestine. So the stomach has got many different cells in it that create different enzymes and acids. There's one cell called the parietal cell that makes a hormone called intrinsic factor, and this will often get affected with bad types of dysbiosis. Because people often have hypochlorhydria, they have underactive stomach. They don't produce sufficient of this hormone, of this intrinsic factor. And if they do, B12 will often not bind properly to intrinsic factor. And then it has to be carried down into the terminal part of the small intestine, down through to the ileum, where there's a small area where intrinsic factor and B12 get taken up and absorbed into the body. Many people with IBS have got a problem with low B12. Low B12, depression, anxiety, numbness and tingling, burning in the extremities. A lot of the symptoms that you talk about are often low B12. Now you need to be careful with B12 because many doctors believe that there's a particular reference range and everyone should fall in that. Well, this is a load of crap. Many people have got their own reference range of B12. Some people need more, some people need less. So it's not fair to look at a low and high and say if you're anywhere on that you're going to be fine. A really good thing to do if you've got low B12 is to have a series of B12 injections, usually 1 milligram per day for a week. You can even go sometimes to pharmacy and buy B12 shots for 10, 15 bucks and then give yourself an injection if you're in doubt. Okay? If you pick up significantly, then you know that B12 really was deficient, regardless of the reference range. Low iron is very common with Candida, Natalie, very common because Candida often cohabitates with many different types of dysfunctional bacteria, and many types of bad bacteria can in fact start gobbling up different proteins and iron stores and different things in the body, which will create low iron. And of course this low iron leads to fatigue and dizziness and drowsiness, and also low iron leads to infections and more immune dysfunction. If you've got low iron, always do a ferritin test for iron storage. This will tell you how long you've had low iron for. Okay? Low blood sugar, very common with Candida. Most people with Candida have got some type of cortisol dysfunction because of their ongoing stress produced by the adrenal gland. So if your cortisol is too low or too high, you're going to get blood sugar swings, hypoglycemia. Blood sugar is also dependent on many different types of minerals and vitamins, which people with Candida often lack. Okay, so magnesium is critical, vitamin B6 is critical, zinc is critical. So I think that you probably would have been zinc deficient and magnesium deficient. These are some of the reasons why I've created now a CanXida Rebuild, so a supremely good Candida multivitamin. It's the first one of its kind because it has a very mild antifungal, antibacterial base, so to gently eradicate these kind of bugs while giving you the nutrition that the cells require. Acid in my urine. Well, pH imbalances are very common with Candida for many different reasons. Often because of the diet is fluctuating, for various other reasons. 9 out of 10 urine tests, always too much white blood cells and infections. I've had over 100 urinary tract infections, probably many more so. I think you've had a serious adrenal problem too over the years, and this often leads to a urinary weakness. Peeing out too much sugar in the blood creates also infections because you're more prone to E. coli infection. So Escherichia coli is the most common pathogen involved with urinary tract infection. Spring, summer 2015, before I found Eric, I could not hardly eat anymore. My stomach said stop. I could only drink cola, eat ice cream, chocolate, coffee, and this was my diet for a couple of months. Well, pretty crappy diet there, but I suppose if that's all you can tolerate. If I ate food, I went up to being 5 months pregnant very quick, and my gut got into extreme abnormal pain. Wow. I was really at the bottom of my rope and started thinking, this can't be real, something is not right. This isn't some disease you can get. And how did I get this? So I started doing my research and read hundreds of different articles, blogs, YouTube clips for 4 months from April to July. And then I discovered I had a Candida yeast infection. So, if I was sick, why didn't I start some Candida program until July? Because I read that so many people who got Candida back, even more aggressive than before, and my body could not afford that. I even contacted some people who've had Candida for many years who got it back and started with your Candida Crusher program and finally got well. I needed a program that really worked and continuing to work for the rest of my life. I've probably seen around 500 of your videos and lots of other Candida videos. I've read a lot of your articles on yeastinfection.org, and you calm me with your expertise and knowledge. That's really nice, Natalie. That's why I had to wait. I had to be sure what I was getting myself into. I didn't want to pick up some random diet that someone had mixed in from some website or blog without any program backing it up at all. I also discovered that most of the other Candida diets don't allow any fermented foods, and this was really confusing before I started to look at your videos. So I started slow, and after a few weeks the brain fog slowly got better. After a few more weeks I could walk again more properly. I could finally start to take walks outside again, and some days when it wasn't so bad I could even go with my boyfriend to the gym and do some small moves. So how do I feel today? It's now gone 7 months since I started your program. Today I'm 90 to 95% free of symptoms and all issues. Most of my symptoms are 100% resolved. This is for me totally unreal. I wake up and jump out of bed feeling great, feeling alive for the first time in 30 years. You believe it? 30 years. This is not me, this is Natalie writing here. I haven't got any pain in my back, kidney, liver, gallbladder, gut, muscles, joints, brain fog or anxiety whatsoever anymore. Yes, I have done a big kidney and liver cleanse and taking your products CanXida for the past several months. They have been a huge help. I can actually feel how your CanXida products work, and also my family. I'm sorry to hear that you were out of stock for the first 4 months. We had a stock out because we had so many people that got incredible benefits from the CanXida range that we got totally blown away by how many orders were placed, and it blew me away. So now I'm going to try and make sure going forward that we don't get these issues with low stock anymore. I've often wondered, is this how healthy people feel? I have, I think, for about 6 to 12 more months to follow your diet, but I don't think about the months anymore. This is my new diet and lifestyle for the rest of my life. I can eat everything again, even those things I could not eat for the past 10 years, and it smells and tastes so great. Now listen, guys, this is very important what Natalie's saying. She's saying, I'll repeat, I can now eat everything again. Don't you believe the crap out there where people will tell you you can never eat bread, you can never eat eggs, you can never eat dairy, you can never eat like chocolate or the favorite food you like. It's a load of crap. You can. Once you get your gut restored, you can eat and drink everything within reason. You can't go out and drink a bottle of wine a day or do stupid things like that. But my aim with the Candida Crusher program and diet and the supplements is to get you back on track, and then to get you the hell off the diet, which you've modified to suit yourself. It's not some sort of a scheme to keep you tied up to anything for the rest of your life. That's immoral. It was not my plan. Heck, I like going out with my wife and having a few glasses of wine and a nice meal. When we were in Canada, we had all kind of crappy foods, you know. My gut is still fine. So don't you ever let anyone believe you that you need to be tied to some program for all of your days, because if they do that, you need to turn around and walk away, because it's not true. And Natalie's living proof here, and I've got many other patients like Natalie that can now actually eat gluten again without, you know, going crazy, okay, and eat these other kind of foods. What I want to say about your so-called specialists and doctors, well, I think I've met around 200 different doctors and specialists over the years, and I don't have anything to say about them. They can't shuffle. Ooh, there's a couple of bleeps here, okay, so I'm not going to say these words. She's basically saying some naughty things about these people. So I can see how Natalie feels about doctors and specialists. You know, a lot of these people have got minds that are closed. I've always been led to believe that the mind's like a parachute. It works best when it's opened up, all right? So, and the other important thing, Natalie, to remember is doctors are often down on things they're not up on. So if you don't know something, you're going to ridicule it. If we don't know about what Muslim faith is, we're going to think that everyone out there is an ISIS terrorist, when in fact some of my best friends are Muslims. So, okay, we need to keep an open mind about things. We need to keep an open mind about gluten. We need to keep an open mind about eating mushrooms. We need to keep an open mind about using medicines, you know, in an appropriate manner. Everything has its place when it comes to recovery. I don't really like following any hard or extreme lines at all. Right? I like keeping an open mind. And I also would like to say there are some very nice doctors and specialists out there. Most of them are actually good people. But because they've got very specific, narrow fields of training, they can come across as narrow-minded people. Thank you, Eric, for saving my life and for allowing me to have a life. That's so nice. That's really nice, and that's what I love being in this business for, is getting these kind of emails and these kind of letters. It makes me realize this is the profession I chose to help people like Natalie get their life back. It's not about ego, it's not about money, it's about helping people, and that's fantastic. And I got another email from Natalie here. This was from, I think, a few days ago. Oh, I forgot to write, she says here. I also had burning feet, toes and burning feet, and woke up screaming many nights for 2 years. It felt like someone was setting my feet and toes on fire, and I had horrible pain in one of my knees. I've spoken to my doctor about this, of course, and he said it sounds strange. I also had very bad carpal tunnel syndrome and pain in my joint, wrists and muscles. Very, very bad pain. Okay, I was walking like a 95-year-old lady. Wow. Okay. She said she even could drop cups. She couldn't even hold cups anymore because her muscles were that sore. The doctor suspected I had multiple sclerosis, but it never got confirmed or diagnosed. Wow, this is phenomenal. So that's your case, Natalie. I'm so pleased that you're feeling like this now, because I hope that your case inspires many other people, not just in Sweden, but in many countries around the world, to follow an approach like mine. They don't have to follow my Candida crusher approach, but if they follow an approach that's going to help them get back on track, it's going to be wonderful. I really hope also that some doctors or specialists may see this video and not see it as a promotion purely meant to sell stuff. I don't care what people do. I don't care if they buy my book or my products. I don't spend all these hours on video expecting anything in return. All I expect is for public like you out there to watch these videos and maybe give you the inspiration to turn your life around like Natalie's turned hers around, because it's possible and highly achievable. Don't forget to grab your free report by clicking on the link below. I've put a really nice report together for people. It's a free Candida shopping list. Also, please subscribe if you're not already a subscriber, because it's for subscribers that I love making these videos. And if you haven't already done so, check out my survey, CandidaCrusher.com. You can also see over 1,000 of my articles at yeastinfection.org. So, I don't know how to say goodbye in Swedish. I'll have to learn that language. But one day I will come to Stockholm and have a cup of tea with you, Natalie. That would be totally awesome. So I'm signing out for today. Thank you for tuning into my video.